As we get ready to welcome the new year, Americans are encouraged to be cautious with serious viral infections on the rise. This year alone, the U.S. has reported 28,000 cases of the highly contagious whooping cough. It's the second year in a row where more than 25,000 cases were reported nationwide. Those statistics have raised concerns over fewer people getting vaccinated. The infection can lead to severe illness or, in extreme cases, even death, and there are already 500 cases here in Arkansas. We decided to bring in a specialist from the American Academy of Pediatrics to explain what this means. Rolly?
Yeah, Brooke, we've got Dr. Josh Lyon here from All Kids First.
All for Kids.
All for Kids here in Little Rock. And we call on you all the time as we get into this kind of season. There's all kinds of bugs going around, but the real alarm out there is for the number of whooping cough cases which are there, and it's a nasty virus. What's this do to kids when they get it?
Yeah, absolutely. And so just like you said, we're in the middle of huge respiratory season, but one of the things we're talking about more than anything is whooping cough. So pertussis is the bacteria that causes whooping cough, and in your kids, especially problematic because just like you're mentioning, for those kids, they get these paroxysms of coughing where we cough, 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 cough so much that they can't breathe. We turn blue around the mouth, and the only thing that stops it for those kids is this giant gasp of air, this where you get that characteristic whoop. Absolutely.
How many cases are you seeing? I mean, we hear that it's spreading way more than it has in many years. Yeah. What's it doing to your workload at the clinic?
Yeah, absolutely. So, every 4 to 5 years or so, we really expect to see a little bit of an increase in whooping cough. I think 2017 was probably the last time we really had much of a peak. And so last year to this year, we've continued to just see climb and climb and climb. And so during respiratory season, it's made us much more cautious as the whole. While flu and RSV and many of these things are filling the clinic characteristically, because early whooping cough looks so similar to these things, we're having to be much more cognizant for each and every family that comes in about what that may look like.
Does it include like different kind of quarantine procedures, or like does it spread differently?
Absolutely.
Yeah.
So the first 2 weeks of whooping cough is when you're much more likely to have less of that characteristic whoop, less of that characteristic cough, and much more of just runny nose, congestion, drainage, maybe a mild cough here and there. But that's also the period where you're most contagious. So while we're kind of moving around thinking this is a common cold, this is something small, we're very actively spreading it in a much more dramatic way.
Can you get a vaccine similar to the flu, like you can get the flu shot and maybe protect yourself for the rest of the season? What's the state of whooping cough shots that you can get to protect yourself, or is it just the regular precautions you'd have to take just to try and avoid any virus?
For sure. So as compared to even like your flu vaccine, your pertussis vaccine, your whooping cough vaccine is much, much more effective. And so it's one that we recommend for pregnant women every single pregnancy because they'll pass some of those antibodies maternally to the new babies. And then for children, routine recommendations at 2 months, 4 months, 6 months, again at about 1.5 or so, and then at 4 years old, 4 to 5 years old.
What do you do to get better? Yeah. If your kid is coughing, do you just cough syrup and ride it out, or there medicine you can take?
Yeah, and one of the hardest things about whooping cough, and one of the reasons prevention and the vaccine component is so important, is that realistically, by the time you start coughing, there's not a whole lot that you can do that changes that course. If you catch it early enough, antibiotics, so there are antibiotics medicines that we can take to slow the course, to prevent the course early enough. But once those paroxysms, once those whooping and that harsh cough starts, we call it the 100-day cough, because at that point, there's very little that's going to change the course of the cough that's there.
So you just got to ride it out at that point.
You ride it out at that point.
What do you look for if it gets really serious that maybe they need to go not only to a clinic, maybe to an emergency room?
Absolutely. So the kids who will wind up hospitalized, especially the older adults, the children who will wind up hospitalized with this, those are the kids who, when we talk about those paroxysms of coughing, are coughing so hard and so dramatically that, one, they usually can't eat because we're coughing so frequently, and then we're moving right into vomiting, and so getting dehydrated from that perspective. And many of these kids will be coughing so frequently and so much that because they can't catch their breath, they're gasping for air, they're actually turning blue around the mouth, around the face. Those kids will need extra oxygen, they'll need extra help to maintain their breathing, to maintain their oxygen. Those are the kids who will wind up in the hospital.
Get your shots, folks. Hopefully that doesn't come to your family as we go into the busy season. Dr. Lyon, thank you so much for coming.
Thank you, guys.